Hello, my name is Adam. I'm going to demonstrate how to change a dressing to a chest tube. So I'm looking at my order and my patient. I have Jennifer Doe, date of birth 11/5/1975. She has no known drug allergies, and I have an order to change the dressing to her chest tube. No known drug allergies. I also need to know if she has a drug allergy to cleansing solution, in this case normal saline, iodine as well, if that's what we're using. And to tape, if she has an allergy to tape, we're going to use skin prep before applying the tape. So I have all of my supplies, so we're going to enter the room and meet the patient to do the dressing change. Good morning, Jennifer. My name is Adam. I'll be your student nurse today. Can I get your full name and date of birth? She tells me 11/5/1975. I'm going to give us some privacy. I'm going to check her band. Her band checks out for her full name and date of birth. Very good. Okay, and could you tell me if you have any allergies to anything? She says no. Do you have any tape allergies? She says no. Any allergies to cleansing solutions, maybe normal saline or iodine? She says no. So that's good. So you are due for as we discussed earlier, you're due for a dressing change to your chest tube. We gave you that morphine. Okay, that'll help out with our dressing change. So I'll be obviously checking for adverse reactions after doing that pain assessment, and we charted that. So, okay, so first things first here. We're going to expose our area, the only area that we need here. So just about like this. And then I have a chucks that we'll place underneath, okay, to collect our our dirty dressings and stuff, okay? So here I'm just going to get our area ready. So here we have normal saline, and we checked expiration date on it. So expiration here, December of 20, so we're good. So we have okay, we also have some cotton tipped applicators, making sure you only touch these ends here. Go in there like that. More. As is. I have my patient comfortable in a semi-Fowler's position here. So I'm also going to prep my area. Here I have my Vaseline gauze. I got my drain sponges, my slitted drain sponges, and then I have my 4x4 here that we'll be using. My 4x4 gauze will go on top, my sterile gloves as well. I also have a biohazard bag set up. I have my foam tape that I'll be applying. Obviously gloves and hand sanitizer. Okay, so first thing is I'm going to look for any drainage or any shadowing on the outside of my dressing here, noting any if there were. So the next thing we're going to do is we're going to feel for what's called crepitus. So that we're going to go around, starting near insertion site, working our way around and out. Okay, like this. If I was to find any, I would mark it, and then we'd continue to assess it. If it continues to get worse, that's when we would notify the physician. So, okay, now that we've assessed this outside and checked for crepitus, we're going to remove the dressing. So I do not want to I need to secure my tube to prevent dislodging it. So I do not want to be resting it on the insertion site. And we're gonna work towards the insertion site here. Like this. Okay, so set down our old dressing. While we're doing this, we're looking at, here, let's get this off first. One more. Okay. And then we have our so we're going to look at our old dressing. We're going to look for any color, any odor, consistency, so color, odor, consistency, amount of any drainage that we see. Okay, so there we'll put this inside our biohazard bag right here. And then we're going to look at our site. We're going to assess the insertion site and around the skin around it for any redness, edema, ecchymosis, any drainage, and then the approximation, which we're well approximated. So looks good. So next what we're going to do is use a no-touch technique. You can, here we'll change. So here we're going to clean our area with our cleansing solution using our cotton-tipped applicators. Okay. So here, like I said, no touch. We're going to start and use a circular motion, working our way out in a circle, rotating, using all of my, I'm going to toss those in the trash, toss them, and more if need be, going around. Okay, we got our site clean. Okay, so now that this is clean, we can put on our sterile gloves here. Okay. Noting that the outside 1-inch border is considered not sterile. Okay, so our next step here is that we're going to grab our Vaseline gauze. Okay. And we're going to make what's called a ribbon. Like this. It's kind of a twirl like that. Alright, so the we don't want to, we're going to remain sterile as sterile as possible. So one way to do this is to that. I'm going to go up and around this. Like that. One more. Like that. Come up, and then we're making our occlusive like this. Okay. Making sure that's up. Occlusive site. Okay, next we have our slotted dressings. And do one like this, remaining sterile. One. Like this, going over. Like that. And our last one here, we have our 4x4. Okay, it's going to go right over top, cover. Okay, so here I got Vaseline all over my hand, my gloves here, so I need to get a good grip of my tape. So we're going to, our sterile technique now is ended. We're going to wash hands, put on clean gloves. One more here. Okay, so our tape here. Okay, so note here is that when I unravel, we don't want to touch the inside of our tape. Okay, we want to keep that clean. Okay, so it should take about 3 of these pieces. We're going to want to keep an airtight seal. So let's keep this out like this. I'm going to go across. Pressing firmly. Like I said, to make an airtight seal. It's hard to say. Okay, we're going to do that again. Keeping the middle clean. Tear. Pulling tight, going over, overlapping. Obviously this would stick a lot better to a human, like this. Do one more. Good. So, right here. Okay. Friendly. All right, now we got our airtight seal. Very good. So let's check in. How are you feeling here, Jennifer? We got everything changed here. I can get you covered back up. What I want to do is I'll want to initial the date, time, and my initials on here, just for our dressing change purposes. We're going to cover you up here, okay? Get rid of all this. I had tossed away all that. I'm going to clean up my area, and I'm going to ensure safety with my patient. You know, low bed, floor mat, call light, bed rails up. With my chest tube, I want to make sure there's no dependent loops. Make sure that it's upright. My chest tube. I'm also going to keep them in a semi-Fowler's position to promote drainage. I'm going to, when I document, I want to document obviously that my cleansing solution that I used, any drainage that I had noticed, any coca ureta, if there's any crepitus, the date and time. I'm also going to put in my assessment findings for my patient, respiratory status, cardiovascular assessment, my vitals. I'm gonna any lifespan considerations. Really, I mean, lifespan considerations really any age. I feel like with young kids, you might want to have the parents in there because this could be, you know, they could have a lot of fear involved with this, with pain and stuff. So this concludes my video.